Good. Just like go shoulder down a little bit. There you go. Marked difference. This is all popped up right here, and how low this side is over here. If I put a marble on your back, it's rolling off to your right. Ooh. I call this the dental hygienist part of my visit, where I'm just going in here and cleaning and scrubbing plaque off, right?
Yes.
There's not plaque on the neck. Okay, oh my gosh. I didn't mean literally plaque, guys, okay?
So I've been in the dental field now a total of about 10 years. So it's just been like really hard on my body, my neck, my shoulders, and then just in general, I get headaches. I have like TMJ jaw issues, so I have headaches from that. And even lately I've been having like ear ringing on the same side. Okay. So I have a feeling it's correlated. Okay.
Have you sought any care? You've had some chiropractic care?
Yeah, so through the years I've always gotten care for with chiropractors, but in the last like year or so I haven't been able to get in, so I've really noticed a difference.
Okay. See, just like I mean, everything almost directly translates from dentistry. You know, the alignment of your teeth matters. For instance, our ear, the external auditory meatus belongs over the middle of your shoulder, and the more forward our head goes from our shoulder, the more tension we're perpetually going to have in our neck. No matter how much we rub the neck, no matter how much we exercise or massage or gua sha, if the head is forward from the shoulders, there's going to be constant tension in the muscles, the joints, and the discs. Now the discs we can't feel, similar to the enamel on our teeth. And so we can wear out the enamel without any awareness of it until we have nerve pressure. I don't think you're there yet. I don't think you have nothing going down the arms yet. No numbness or tingling or burning. Okay, so we just got joint inflammation, muscular tension, because we're working a job that is, you know, you're stuck, right? You can't like, just a moment, let me back stretch for a second, right? So our posture is a distillation of whatever position we're in for the most amount of time. And so if we hold our bodies here, when we go to stand up, our body doesn't reset back to center where we belong. We've retained some of that posture, and now we have all this tension. And so the tension from the posture affects the drain lines. So we have lymphatic drain lines coming down our neck, and that will affect the ear. It'll affect, you know, these glands all around your neck here. The more forward our head goes, the more forward the jaw goes, and that inflames the TMJ. You know, the joint here gets inflamed. And so we want to get the head back over the shoulders to alleviate tension on the jaw. The headaches comes from the suboccipital. So they found, this is actually the first thing they give you when you get to chiropractic college. Like, maybe you can tell me about dental hygiene. You know, the first thing when you're all excited to be a chiropractor, you sit down in school and they put this paper in front of you, written in the 1940s, late 1940s, and they took salt and they injected salt at every nerve root. So at every level, there's little wires, and so they took salt and injected it at every level, and chiropractic started in 1895, but this is the first time we got the blueprint. So when they injected, for instance, the lower neck, people experienced, you know, lower neck pain, and they experienced symptoms in their arms. If you injected the lower back, you felt lower back pain, also down the leg. When they injected the upper neck, people got upper neck and headache pain. So they found that essentially inflammation of the upper cervical will give you a referral pain to your face. And so we call that a cervicogenic, or a tension headache is commonly called. And so we need to do work in doing a couple things. One, aiming your spine back to where your ear is over your shoulder, and then also, not only is your ear belong over your shoulder, but your neck is supposed to have a curve to it. Believe it or not, there are nerdier chiropractors than me that all they care about is getting the head over the shoulder. They don't even talk about symptoms. So in essence, I don't really treat symptoms, I treat posture. I believe that posture is what creates almost everything I'm reading on here. You know, the shoulders, this is all, you know,
and that's like exactly like the base of my skull, like that's exactly where it starts, and then just...
We'll help you. You're in the right, you're my bread and butter. How long has the ringing in the ears been?
It's just started like within the last month or two.
Do you have any...
And I've never had it before, so I don't know. I don't know if it's correlated to my job and because I haven't had like chiropractor work done, if it's just gotten worse.
I'm gonna pick on anything you make a mark on here. I'm gonna pick on. It says fainting. You have
not.
You put it on here.
I know. There was like a time where like I had like a couple fainting spells. Kind of
How long ago?
For no reason. Not recently. It hasn't happened in the last couple of years, but I just like to notate that. But yeah,
when would it occur? Like when you go from sitting to standing, or would you feel like it was just even when you were standing, you would just feel faint?
Yeah, there was a couple times where I was just minding my own business and it kind of happened, but thankfully it hasn't happened since, so I'm not really sure what the cause of that was.
So the circulation to your skull, usually fainting is decrease in blood pressure to your brain. When you go to stand up, the heart has to beat harder to get blood out of your legs and to help increase circulation to your skull, or if you go from laying down to a seated position. The tension in the neck does influence the circulation, right? So if there's all this tension in here, the muscles that are around the carotids can inflame them and make it harder for blood to get up into your head, skull. Okay. And so it's plausible that they're all connected together, that forward head posture, tension. I'm just picking on you here. Now we're doing with a couple things. Your head's about an inch forward only, but the shoulders are forward. So, for instance, if I put my head forward, but if my shoulders come forward, right, it doesn't look as misaligned. Does that make sense? So there's a couple things going on. Because of your work requiring your shoulders being forward, if I pulled your shoulders back, that makes sense?
Yeah.
Then it looks worse than it really, actually is a little bit worse because your shoulders belong more back here, and then the head goes forward because of our life being bent forward. I'm just going to go through your back a little bit, make sure everybody's moving a little bit. Everybody cross your arms. All right. Take one little sit up for me, and then take one deep breath in. Try to relax your chest. There you go. Just relax. I got you. Beautiful. All right. Deep breath in. Two more. Try to relax your back. Let it all go. I got you. Real gentle. There you go. One more for me. You're doing great. Let your chest relax. Very nice. Okay. You haven't lost everybody yet. They're all still working. It's a good sign. Hands around your belly for me. Perfect. Take a deep breath in for me. Try to look over the shoulders best you can. Try to relax your back. Exhale. Try to relax. There you go. Not going to hurt you. Good. Other side for me. All right? Mm-hmm. Go with it. You start poking every tooth, seeing if there's any sensitivity. I'm just going to go through all the vertebrae, right? Okay. Same kind of thing. Take a deep breath. Exhale. All right. Good. Face up for me. I got you. All right. Yeah, we just got way too much tension, right? So one of the reasons why I'm a big proponent of laying down adjustments is because we take gravity out of the equation, right? You'll see chiropractors sometimes adjust people seated, and then they'll say, oh, there's all this tension in your neck. And I go, well, yeah, because they're still fighting gravity because their posture's crappy. That makes sense, right?
Yeah.
So you have to lay down to take posture out of the equation, right? You can't do a seated massage and go, oh, there's a lot of tension. Yeah, because they have bad posture and their head's forward and the muscles are tight because of their posture. Why is this so hard? Why is this so crazy? You have to lay down, people. Anyways, why do you always adjust laying down? Because I take the weight off the frame. I can't work. You lift the car in the air. Right. You got to take the weight off the suspension when you're working on it.
Yeah, that's a good analogy.
Anyway, why don't you adjust them seated? What? Work on that one knot there. I got you. You're doing great. Okay, yeah, we got work to do on that knot. Okay. Just doing round one here. All right, real easy. Relax this right side a little bit. Okay, yeah, okay. It's okay. If it moved beautifully, you wouldn't need to be here, okay? Sure. All that tension up here is my job. We got to work on this. And the tightness of your upper neck is why there's inflammation buildup, why there's going to be lactic acid around the nerves that up here, and it's going to cause what I call gingivitis. I'm not calling this literally gingivitis, people, okay? It's inflammation of the cervical region, but exactly. He called it gingivitis of the neck. I don't understand. This guy's a kook. Oh my God. It's an analogy, and she's a dental hygienist, okay? So I'm going to use some
How
of
my brain works.
these are words that she's familiar with, very familiar with, because she works in a profession where she sees gingivitis like every day.
Yes,
and so
unfortunately.
I see gingivitis of the spine, you know, inflammation of the tissue. Anyway, so there shouldn't be any soreness. Obviously, in the mouth, right? The gums shouldn't be bleeding.
Right.
It shouldn't be all inflamed.
Yes.
Well, my gums have always been inflamed.
Right.
That doesn't matter to me. That doesn't make it okay. Like, oh, okay, you were born with gingivitis. Oh, okay. Then it's just this. Hey, everybody, this patient here, it's just normal for them to have gingivitis. They've had it since they were a kid.
Thank you.
That makes sense. You wouldn't accept that. That wouldn't be
Right.
an acceptable thing. Like, okay, no. No, I've had bad posture my whole life, so it's just okay. My dad has bad posture, my mom has, oh, okay, well then you'll just keep your bad posture then.
Right.
This is not the way this works.
Yeah.
Our
Yes.
world doesn't really necessarily guide us in
Right.
spinal care. We
Yeah.
literally just, we react to problems. We aren't really proactive with spinal problems. We wait till what I mentioned earlier, which is disc injury, and disc injury is the foundation for every back surgery. Well, no, Dr. Ed, a bone spur hit the nerve. Well, the bone spur would have never hit the nerve if the disc was healthy. So it's still the disc at the core of why operations, fusions, and discectomies, and rhizotomies, and laminectomies, all these spinal surgeries that are performed ultimately happen because the disc is injured, and disc injury is so pervasive because we can't feel the disc. Just like the enamel on our teeth, we can, if you saw a patient or evidence of grinding,
Yeah.
and the person said to you, well, it doesn't hurt, you'd say, well, it doesn't matter. It's still not
Right.
good for your teeth. And if
Yeah.
you keep on grinding like this, it will eventually really hurt
Yeah.
because you're going to run out of enamel, and then the nerve root's exposed. And
Exactly.
Anyway.
You know a lot about teeth.
Well, it directly translates. Everything you know about the enamel, you need to start understanding about the disc. They're the analogous, the enamel doesn't heal, right? You don't regrow enamel, right? You're not going to, put something on my teeth and my enamel will regrow. If you
Right.
chip a tooth, sorry, right? That tooth's not growing back.
Yes.
If we herniate a disc, the disc does not regenerate. It can rehydrate, we can polish your enamel, right? We can do things to make it look better, but we can't regrow it. Your neck is supposed to have this nice, arch to it. And as odd as this feels, this is where your neck belongs. And so everything I do today is to aim your spine probably into a position that you're not very that feels foreign.
Right.
Right?
Yeah.
And this doesn't feel natural, Ed. It should feel natural. And if it felt natural, you wouldn't need to be here. And that's the whole purpose, is to aim you back into this curve. I got you, I know. I just feel a lot of resistance to getting your neck arched. There you go. Yeah, way too much tension right there.
That's my problem there, yeah.
Now, was it the right ear or right jaw? Which jaw is the worst?
It's on the left
is-
ear and jaw
left ear,
side,
jaw.
yeah.
Okay. Oh, you have to get your neck normalized to being back here. And then there's a piece of foam called a Denerol that just emulates my hand. And this is the tool, and it's supposed to hold you as close to this type of position as possible. And we'll show you at the end of the day how you can stretch and work on this curve. I know. Relax, relax. I got you. Breathe a little bit. Let it go. Shoulder down. Let it go. There you go. Wow. Yeah. A second. Oh, let this side go. Shoulder down a little bit. There you go. All right. Yeah, real quickly it came up in like 2 or 3 swipes right here. It's all, pretty gentle, right? I didn't even push that hard.
No.
Real quickly it comes out. It's hard to show on film that I'm not pushing that hard.
Yeah,
And
it
what-
doesn't feel like...
Yeah, what's inside is what is being drawn out, and this is what irritates the suboccipital nerves, a large contributor to the tension and pain. Now, just massaging it and gua shaing it, unfortunately, we'll just come back in a few days, right? Because we have to get the posture fixed,
Right.
which is the reason for why it builds up. And so I call this the dental hygienist part of my visit, where I'm just going in here and cleaning and scrubbing plaque off, right?
Yes.
There's not plaque on the neck. Okay, oh my gosh. I didn't mean literally plaque, guys, okay? It's just inflammation here, okay? It's just inflammation built up in here. No, I literally mean there's plaque in here, guys. You can't comment about that. This guy's nuts.
Did he just come?
I don't look at this joint independent. This joint is connected with the forward head posture. And so working on getting the head back, the curve in your neck is going to alleviate tension on this joint.
Mm-hmm.
But I can feel there's soreness right in there.
Mm-hmm.
I just don't believe that it can be alleviated just by, rubbing this area. I don't believe that's other than maybe very temporarily, it does help it to symptomatically feel better to rub it, but
Mm-hmm.
we have to address the forward head posture. Right there's a bigger knot. Have you noticed this before anybody's pointed this out? No. Feel this right here.
I feel, yeah.
I mean, it's marked difference. This is all popped up right here, and how low
Yeah.
this side is over here. If I
I
put a
can
marble
tell
on
the
your back,
difference.
it's rolling off to your right. This is an injury that then gets fed based on our posture. So, for instance, if you injure this left side of your back, your body's you're saying tilt away from it, and that then makes it larger. I think that's what I saw when you were standing, right? Left shoulder was elevated.
Mm-hmm.
You were leaning away from your left side. It's like if you broke your right ankle and you hop around your left ankle, you don't notice your broken right ankle anymore until I tell you to put some weight on that.
Mm-hmm.
Oh, it hurts. It didn't hurt until you told me to put weight on it. Right, because you're avoiding it. We call that antalgia. You're away from algia, pain. Your body's just holding an away from pain posture. Now, eventually, do you see what you'd wear out? You'd wear out the right side.
Yeah.
Right, because this side's carrying more weight. You're avoiding this. And so the first injury is going to be right lower back. And was your right hip that you said was clicking?
Yeah, exactly.
Yeah, it's not a coincidence that the right hip is probably dysfunctioning. Right there. Right there.
Yep.
Okay, take a break. Yeah, I like when you rub the right side of my back head. It feels good over there. Mhm. See, the side that's overworking doesn't necessarily hate the idea of moving, right? Because it's already loose.
Right.
That's why it'll hurt, for instance. But it's the restricted, stuck side that's going to be the most upset with me, making it function in the way it's designed to. The right side's already loose over here, and so it doesn't feel too bad, right? Because it's already moving. And we're not necessarily at the complete abuse, destroyed level yet. That's 45, 50, later in life when people finally wear out the discs based on the alignment they were in. All right, here we go, right there, yeah. Sitting will lock this joint. I know it's going to be sore.
Yeah.
Too much sitting will stiffen this joint between the sacrum and the ilium, and so it's important that we keep this joint mobile. And there we go, right there. Oh boy, okay, all right, okay. A lot of muscular tension, so when you move this hip around, it's going to be clicking. Now, sometimes these muscles can get activated because there's slight nerve irritation in your lower back, because the right side of your lower back is more active, you can start getting, before there's symptoms of pain, you get tightness. Way before somebody has sciatica, they'll feel like there's tension in their leg. You understand?
Right.
Years before they have full-blown shooting pain down their leg, my leg just feels tight. My muscles feel contracted.
Yeah.
And it's like, well, what is that? Well, it means the nerve is starting to get irritated, and there's not pain yet, but there's the signals to the muscles are contracting. And so you can have tension around your hip, and it's not necessarily because you purposely are contracting the muscles, it's because there's a little bit of nerve irritation in your lower back. There we go. Yeah, right there. I didn't know it was there, Ed, until you touched it.
Yep.
I know. I didn't know. Yeah. Epicenter's right here. Any car accidents or falls off of trampolines, horse riding falls? What when you're a teenager?
No, thankfully.
No, older brothers kicking you
No.
down the stairs? Okay, all right. All right, perfect. When we're stretching in a minute, you might feel like you're not laying on it straight. While you are, in fact, laying on it straight, but because this side is so elevated, you're going to feel like you're lopsided on it. And as you progress in your stretching, that will level out.
Okay.
Just giving you a picture of the future. What more stretching in a minute. You're going to, am I on this thing straight? Yes, but your back's crooked. So it's going to feel like you're not on it straight when you are. As you progress through your stretching, it'll level out. This is some of the nerve irritation that goes to her right hip. There you go. Oh. You okay?
Mm-hmm.
Okay. Piece of cake, yeah. The elbow is the hardest part. Uh-huh. Yeah. I think you might need an hour in here. Uh-huh. This is
Yeah, that shoulder, I always have a huge knot there.
all your fine motor control movement when you're working on people, patients.
Yeah.
Gotta push these ribs down. Right there. Ooh. Okay, you all right?
Mm-hmm. Yep.
Yeah, right there.
Yeah.
Ooh.
Oof.
Help me. Help. Yeah, right there. Have you had any massage like this? Not so much, no?
I do get massages done, but I haven't gone
Nobody's-
in a couple months. But I feel like they never, you know,
Go that deep.
right.
Nobody's picked on this knot on this left side? Nobody's?
No,
Okay, oh boy, all right,
I mean the right one,
Then
but I didn't even know. Again, the left one I didn't know.
There you go, right there. There you go. Ooh.
Yeah.
Easy. There you go. Oh. Perfect. Okay. It's like the top part of it. The top part of that injury on the left is right there. Kind of spans this whole section, but that's the. All right, when you go to the store later and everybody's, oh, honey, are you okay? Right?
Oh, yeah.
Yeah.
Yep.
So that's that tension in that suboccipital area.
Mm-hmm.
I got your leg here. We go. Relax. Ooh. Okay. I got you. Good. Nice. This is going to be the rest of your life. If you're going to continue working on teeth, we're going to need to have, at the end of your day, time to mold this curve back in your neck.
Okay.
Takes about 20 minutes when you're in a good posture or a bad posture to change where your body thinks center is.
Mm-hmm.
We have two brains, right? We have our cerebrum, right, and our cerebellum, right? This little mini brain back here. And in your mini brain, called the cerebellum, stores what we call the blueprint, or where your body thinks center is.
Mm-hmm.
And your proprioceptions, the sensors from your body basically tell that cerebellum where you are. And so if we spend a lot of time here, this then becomes where your body thinks center is.
Yeah.
Right? And so we alter the blueprint of where we are in space in our brain by holding ourselves in bad positions. And so if we're spending 8 hours or 10 hours here, your body retains some of it. So we have to actually hold you in what we call the mirror image stretch to undo that.
Okay.
And that's all this is. It's just, sometimes I'll take my hand, place it on my forehead, try to get my head to sink in.
Mm-hmm.
Make sense?
Yeah.
And then you put your hand back down and see if your head will stay there. You want to try to contact the middle upper neck enough that your chin is going up over it, but I don't want this as low as it could be in your lower neck. So kind of middle upper neck. I'll show you the wrong position just so you can see. So if I don't want it so high, that makes sense?
Mm-hmm.
That
Yeah.
your head's not going over it. I don't want it as low as it could be down here.
Right.
So it's kind of middle upper neck. Your chin is up. You'll put that hand on your forehead, you press,
Okay.
and then you do 20 minutes. 20 minutes is not a made-up number. It's a number for how long it takes to stretch ligaments and to affect that cerebellum and change where our body thinks center is. So try this. Head back for me as best you can. Let's see if we can. I know it's going to feel. I got you. I know. Bend the knees for me. I think we're okay. You okay there?
Yeah.
A little bit? All right, so the design of this guy is to be thin enough to get in between your shoulder blades, and then we kind of roll down the spine. Okay. So let's try to roll upwards. Try to roll towards me, out this way. There you go. Get the idea? And you work.
Oh, okay.
So you're going to, about every minute.
Awkward, but yeah.
It's okay. Yeah. Every minute you're going to move 1 inch.
Oh, okay.
Is the goal. So you stay in one spot, and then you
Keep moving up.
Yeah, go ahead and roll upwards a little bit, right? Move, and then have that. It'll go down your spine, and stay right here. You okay?
Mm-hmm.
Now you might feel, like I said, I feel like it's not centered or I'm crooked on it.
Mm-hmm.
And again, that's because your left side of your back is more elevated, and so you might feel like you're falling off to a side. And as you stretch more, the side that's more elevated will level out with the other side. I gotcha. Just a way to get her loose. She's really just ready for stretching right here. This is really just needs to be. You're doing great. It's this left side, right there. This is where I'd be spending my time, right in here.
Yeah.
Just holding, holding pressure. Take it for a couple minutes right here, a couple minutes right there, and then you come back up and okay, let's do another round. 2 minutes here, 2 minutes here, and just try to. We have to counter stretch. You did great.
Whew.
You did great. Yep.
All right. Yeah, that was great.
It's a lot of like stuff at once.
It's good though. It's all like good information, and I feel great, so it's good. Yeah.
Wonderful. Thank you so much for dropping in. Thank you. All right.